Okay, so good evening, everyone, and thank you so much for joining us tonight. This is actually hard to believe, but our 12th virtual town hall since coronavirus arrived here in Maine. And we're so glad that we have these means of communicating together and answering questions and also just sharing information about what is happening in the world around us. On that note, I want to start by saying that I know the past few weeks have been so difficult for all of us. Our country and our state are facing two crises simultaneously: the unprecedented coronavirus pandemic, but also a reckoning with our country's long history of systemic racism and injustice. And while these two things may seem like distinct issues, the fact is that the two crises are related in very real and important ways, especially for people of color here in Maine, but also across the entire country. So for this evening, I'm so glad to be joined by Fowsia Musse. She's the executive director of the Maine Community Integration. And Fowsia works both as an advocate for New Mainers, but also communities of and people of color in Androscoggin County. She connects them to services they need, but she also helps organize people to address issues like coronavirus and the tools that we as communities and her communities specifically need in order to meet those challenges. Now, before I turn it over to Fowsia, I want to talk briefly about how these two crises in front of us actually intersect. The protests over the past few weeks have reminded us that millions of people experience life differently because of race. Whether we think about access to education or to healthcare, whether we think about rates of poverty or rates of incarceration, whether we talk about basic safety or the freedom that comes with basic safety, the freedom to do everyday things like go jogging or sit in your car or even have an interaction with a police officer. The reality is we have in this country allowed systemic racism to continue, and that has left communities of color in greater poverty, disproportionately incarcerated, disproportionately living with poor health. And at its worst, people are in danger and have been murdered because of their race and because of the color of their skin. It should be clear to all of us that the impacts of systemic racism as they exist in America today aren't limited solely to the criminal justice system. And I know that is where a lot of our conversations have been focused in the past few weeks. But these disparities extend in areas like healthcare access, education, housing, and overall economic opportunity and safety and well-being for families. For example, people of color are more likely to be essential workers like grocery store clerks, public sector employees, even healthcare support staff. And on average, people of color also have less access to healthcare and also are more predisposed to health conditions like obesity, diabetes, or asthma. Combined with a higher likelihood of living in a congregate setting and less access to safe housing, people of color are disproportionately at a higher risk of getting COVID-19 during this pandemic. That is exactly what we've seen play out. It's happened in Maine more so than in some of the other states around the country, but it has happened everywhere. And while the Trump administration has failed to collect adequate data on racial disparities during this pandemic, the data that we do have shows a clear pattern. Overall in the country, Black Americans make up 25% of coronavirus-related deaths, even though they make up only 13% of the population. And in Maine, that disparity is more severe. Black Mainers make up more than 22% of all positive coronavirus test results, while making up only 1.6% of Maine's population. As of June 3rd, Black Mainers were 20 times more likely to test positive for COVID than white Mainers. Those statistics have to serve to remind us that there are structural inequities and institutional racism that exist throughout our society, from the criminal justice system, yes, but all the way to healthcare and economic opportunity. We have to do better, but saying we're going to do better is not enough. We have to commit ourselves, acknowledge out loud that we are committing ourselves to standing against racism and injustice wherever it is present and to fighting for real change. Now, that starts with the acknowledgement of what exists right now in our country, but it continues with listening and with difficult conversation for too long that we have ignored as people and also that we've ignored as public and elected officials. We have to make changes to our education policy, to our healthcare policy, to our criminal justice system, and we have to continue the work of combating racism on an ongoing basis and doing it together. It will be hard, it will be uncomfortable, but we cannot wait for the next act of brutality or murder before a conversation turns into action. I want to thank everyone for being here today, but I most especially want to thank Fowsia Musse for being here today, and I'm so looking forward to hearing from her. Thank you so much, Fowsia, and welcome.
Thank you for having me. My name is Fowsia. Like you already mentioned, I'm a mother of 5. I moved to Maine back in 2003 from Atlanta, and I'm currently working in Lewiston with Money Organization. I want to mention that because of the coronavirus, we put together a coalition of new Mainers, and we call ourselves Barefoot Community Health Outreach Workers. And so we are using a strength-based approach. We are very resilient people. We're drawing from lived experience of surviving money wars and money adversaries as children and also as adults. So it's been really, that strength-based approach has been working for us. We are not oblivious to a lot of the implicit bias, racism. As an immigrant who's not born in America, it's really hard to detect, that subtle implicit racism, but it's something that we're learning daily and we're impacted daily. We don't see a lot of the explicit, name calling anymore, at least at this pandemic time, which is very helpful. But at the same time, we also get a lot of help from a lot of our surrogate and local community. Um, I'm going to say something about the history of Lewiston. Lewiston, particularly area called Tree Street, is highly condensed. They have a lot of housing problems. There's existence of lead poisoning issue. There's a radon. There's a high poverty. There's a lot of intergenerational poverty as well amongst the longtime Mainers, especially longtime Lewiston residents. So in it is the immigrant who also are coming from a war-torn country, who are often Black and a lot of times Muslim, because the first influx of refugees who are also people of color were Muslim from Somalia. So we have a compounded issues on the top of this pandemic. It's not just a pandemic, but what we need is a collective impact approach. You can't leave behind the Book Mainers either. And right now, this pandemic, what I'm seeing personally is that many of the local white poor Americans are in the same boat with the immigrants also, whether it's a socioeconomic, whether it's a poor housing, shortage of food, opioid crisis that we're now seeing in our state. So many categories, they're in the same boat with us. But what we don't have is we are not working together. We are working separate and we treat each other's problems as a silo issue. And I think historically, United States, communities of color are divided from the white community. So when we face issues of injustice, whether it's a police brutality or whatever, it becomes the othering issue, and that's their problem. But my problem very often comes to my neighbor's backyard too. If we don't stop what impacts my son today, it will impact other people's sons tomorrow. So I think I would like to see some kind of a unifying voice, and I would like to see a lot of collective impact approaches to treat a lot of our problems that you mentioned, Sarah.
Yes, absolutely. And thank you so much for sharing that. I find that particularly impactful when you say what affects my son today, and thinking about tomorrow and having both that short and long-term approach, but also the way that you think about all of the community and that we're in this together. And that's something that we've talked about a lot during these weeks of coronavirus, particularly the fact that we are all in this together, and it is how we will emerge and how we will emerge the
Yes.
strongest, I think. Well, I'm wondering, Fowsia, if you could just share a little bit more about the group that you have put together that is, working outside of the organization that you are already the executive director of, and just what that looks like in terms of outreach to community and literally helping those who need resources. Can you share stories? For example, I think maybe even today, there was some work you did related to that.
So this morning I woke up 10 o'clock, and I know it was late morning for me this morning, but I met Senator Levy and a guy named Glenn from Community Concept. They gracefully and graciously donated a mask, sewing a clothing mask to us, massive amount as a matter of fact, and we've been able to distribute that to local small immigrant-owned businesses, and also to the faith immigrant faith leaders and faith worship centers.
Mhm.
We call ourselves the Barefoot Community Health Outreach Workers because we are certified community health outreach workers. We are certified cultural brokers and also language interpreters. So we came to this group. We came together because we knew how to come together in time of crisis. We were born in a war-zone country where there was no government help. There was no any kind of assistance. So all we had were our strength, our resilience, and our I call our physical health. So
Yeah.
we when the coronavirus happened, which mimic a lot of our problems back home,
Mhm.
social distancing, lack of shortage of food, people running out of rent and eviction, we naturally came together with our strength-based approach and said, who knows what? So we find among us people who were good at computers, so we can develop, social media groups, and that way we can, ask donations. We came together and said, what are you good at? Well, I'm good at doing a door-to-door outreach and knocking people's door. So we then designated different groups within the groups. So we have a housing assistant group, we
Mhm.
have unemployment, and a filing of unemployment. We have a food group that delivers food, people who are especially elderly and disabled, or people who are internally ill even before the coronavirus. And so we designated different groups to tackle this. What we also are doing and are very successful of doing is every time the governor has an order or there's a CDC messaging, that's particular CDC messaging, we've been able to do a culturally tailored and culturally appropriate messaging. So retooling the CDC protocols, and whether
Yeah.
it's the stay-home orders or the 6 steps from the CDC, whatever it is. Just
Mhm.
Saturday we made a video. We make weekly videos about not before it was stay-at-home order. Now it's going to be stay safe order. So we changed that to stay safe instead of stay at home. But
Mhm.
we have a lot of success with that, but we lack a lot of resources too. We're not paid for our time, so of course at this time we are in the same boat with many people who are doing similar work. But we will hope to have some kind of funding to help this because it's not a. It seems like it's going to be a prolonged issue with this pandemic, and so we're hoping that whether it's a state or local or citizens who are watching this, if they can help us with resources. Right now, one thing we really desperately need is housing. And I
Mhm.
know I am part of the neighborhood housing committee, and we're working with the Festa Housing, and we're hoping that the Choice Grant will help 3 Street Lewiston, have a better housing and build new housing. But that's in the long term. For now, the community transmission with corona is happening not because we are unable to speak the language and not because we're unable to articulate. It's
Mhm.
because we have a large families and they live in a very congested small apartments.
Yeah.
And so it's unavoidable for somebody, if they're impacted in the house, to avoid the rest of the family. We're talking
Mhm.
about 10 children and mother and dad with one tiny bathroom and one tiny 3-bedroom apartment.
Mhm.
So because of the housing shortage and housing crisis in Maine, especially in Lewiston, the pandemic now, the transmission of the household and community is now in alarming rate numbers, especially when now we start testing because of that housing issue. So
Yes.
I'm hoping that very soon we start building houses, which is a dream of mine.
Yes. So So Fowsia, to be clear, the housing issue is an issue that you probably were working on and wanting to work on even before COVID-19. But
Yes.
the problem becomes acute when you have this pandemic that spreads and you have people living in close quarters. Can I just ask you, in terms of that, for the community of people that you are representing as you speak tonight,
Yeah.
what percentage of them, or rather, you could just answer, are there a high percentage of them who are people who have been working during this time and are considered essential workers in their jobs?
A large number. My own household, three of my children, my daughters who are 19, 18, and 16, are essential workers. They work, one works at home care, two work in a fast food, and they never took a day off since this pandemic outbreak. I
Yes.
consider myself essential work because I cannot sit home because my community literally depends on me daily, if not hourly. So we, the immigrant community, we have a lot of people who are working the labor department, who are not working a high paying job. So it's almost like unavoidable for them not to have a, not to have contact with somebody with coronavirus. Not a lot of people also don't own their own cars, so they also use a public transportation. There
Yeah.
too, they're at risk of getting exposed. But I think the essential workers and people who are in labor jobs and day-to-day labor jobs and people who are working health home cares, and for example, people who are large immigrant number of people are working home cares today in
Mm.
Maine. When somebody in that household on that particular location resident gets corona, the person who's contacted is told to go home. When they go home, they're going home to their family, even though they were exposed to coronavirus with somebody. So
Right.
there's no system that's helping this person quarantine so they
Hmm.
don't impact their family that they're going home to every night. So
Yeah.
yeah, we have a large number of immigrants and poor people in Lewiston who are in frontline workers and essential workers. Yeah.
Yeah. And I just want to pause for a moment on you're talking about home health workers and the number of immigrants who work in home health, and the fact that this has been in a conversation for us in Maine for the last number of years, recognizing the importance of home health care workers in a
Yes.
state like Maine with an aging population. And we need to make sure that we're taking care of people who are taking care of other people.
Yes. Yeah.
So, so another question I just have for you in terms of testing, you know that we have a number of people in the immigrant community who are working in essential jobs and then going home to their families. Has testing been available in the way that you would like to see?
Well, initially, I wish testing was available. I think we missed a lot of cases, and you know, but now we have some. We have a site. The first site was at B Street, which is St. Mary's affiliate clinic in downtown Lewiston,
Yeah.
and CMC added testing site too last week. To be honest with you, they're having a hard time driving people to a testing site, and I think the fear comes with people who, one, there's a lot of stigma in the immigrant community, and the stigma is similar to that of the AIDS period in the United States. If
Yes.
you are from countries I'm from, tuberculosis, TB was high stigmatic issue. So this whole idea of when you get a contract, when you get contracted with coronavirus, it almost mimics TB and HIV, that social disconnection and staying away from people is creating a lot of fear. And so people now that we have in testing sites, people
Mhm.
are now scared to go to test themselves because they're losing jobs when they test corona. Many of the jobs they work are not going to pay them those period of quarantine time. They worry about exposing their own family. So there's a lot of stigma around the testing now. And so in the next coming 2 weeks, we're working to make a videos that are culturally appropriate and using people who went through the testing. I
Yeah.
was tested negative, but I went through because I have underlying condition called lupus. So
Yeah.
people like me who are the face of the community, we're trying to create a video that can potentially help people to use the fear of testing and to encourage them to test themselves more.
Yes. So, so important. I mean, you've described this a couple of times in different ways tonight, how you are taking, whether it is information and guidelines or safety protocols or executive orders, and literally sometimes translating or otherwise just putting them into culturally appropriate and helpful pieces of information for folks, which I think is incredibly valuable.
Thank you.
Fowsia, is there, as you think about the responses that you would like to see differently from either the federal government or the state government, what would those include?
Oh gosh.
And
um,
that's a big question. I know if you want to,
yeah. Would you reframe that question again?
Sure. Well, I guess, in terms of whether we think of it as literally resources, so for example, you mentioned help with affordable housing. So whether it is tangible resources or whether it is methods of communication or whether it is addressing these systemic inequities and racism that exist in our society, if you were a state or federal elected official yourself, what would you want to do differently or see differently?
I think if I was, what I would like to see differently, one is the communication piece. I was here long enough. I was here during 9/11. I was here many of other issues while I was in this country. And so the language piece, especially people who are in high power, people who are iconic, people who have big platforms to persuade others and have influences. I wish they use more um, inclusion, more unifying, uh, less fear mongering, less othering language. Because I think on the top of pandemic, on the top of a lot of injustices, what is more even damaging is the language many of our iconic people today in America are using. It's very divisive, very hateful, very othering, isolating people, and pinpointing people against each other. That's one. The second, I think, the thing I will do if I was elected, will equity, a proper equity, access to proper equity.
Yeah.
Right now, even in the period of pandemic, many of the immigrant organizations are forced to fight over 5,000, 3,000 grants.
Mhm.
And it's always lack of equity that brings people, the worst out of people. And so this lack of proper equity creates a lot of hostility, brings back a lot of animosity that we either brought from our country of origins or is created here. And I'm seeing that people of color very often are pinned against each other. One is included something, one is left behind. So you always playing this catching up game, 24 hours, you're trying to catch up with something, but you don't know exactly what you're fighting for. So I'm hoping you, Sarah, you'll be that voice. You'll be that, person who unite us. Many of our problems in Lewiston, many of our compounded problems, in particular in Lewiston, is because we have a previous politicians who pin those problems against each other.
Yes.
And so housing, lead, poverty, opioid, so many issues, poor education, all these are not immigrant problem. All this existed before I ever came to the United States.
Yes.
So I wanted the white Americans to stop being bystanders because we need them to be our allies and they need us to be their allies. And so we need to make this problem a collective issue and fight together.
Absolutely. I absolutely agree with you. Fowsia, I have one last question for you. And that is, I realize I don't know the ages of your children, but I'm wondering if you and your family and any of your children have participated in any of the protests that have happened since the murder of George Floyd.
Yes, my oldest is 20,
Yeah.
third year in college. My second is heading to college. So I have four girls. So Shadi is 20, Ismaha is 19, Philly is 16. She's the first one to born in Maine. The others were born in Georgia. Moby, my only son, is 12 today. And my little one is turning 6 tomorrow.
Really?
Yeah, and so, yes. Back
Happy
in
birthday to them.
thank you. In 2016, my daughters and I organized the first Black Lives Matter rally in Lewiston. It was very successful.
Oh, I didn't.
After that, yeah, after that, my two daughters and I signed up for 10 weeks long Bodhi Citizen Academy training that both
Mhm.
Lewiston and Auburn offers, but we attended the Lewiston one 10 weeks long. So to give my kids better balance, understanding what's like to be a law officer, and also right at the same time with respect, fight for their freedom and who they are. And then this year, my daughter had friends who all went to Aurora High School and graduated together the same year, same age. They organized that together, and I'm happy to tell you it was peaceful. It's everything I expected. And so our young American-born immigrants
Mhm.
are more in tune and are more impacted about the race and social injustice in America.
Yeah.
I am, as a Muslim woman since 9/11, I am more impacted very often by my religion attire because it's very visible. So
Yeah.
when I'm walking around, I get to go home or you, the immigrant, but my daughters are more impacted about the color of their skin.
Yeah.
And so we have a lot of debates, very often, a lot of debates about my understanding of race in America and their understanding of their country that they're born to, you know. So it's very funny but eye-opening, yeah.
Yeah. Well, these are, these conversations that you're having in your home, I feel like are conversations that we also need to bring out into the public and for more of us to participate in and think about and understand as we really face what I think is a reckoning for all of us in this country about what we have allowed to exist and perpetuate and the change that we need to make. So I want to thank you so much for the incredible work that you do as an individual in the world, in your community, and for sharing with us a little bit of that work tonight, and also just a sense of what is happening for people in the Lewiston Auburn area and the people that you take care of and work with as well. So I look forward to working with you in the future and continuing to think about the change we're going to make together. And I think with that, we'll probably close this portion of tonight's virtual town hall. Thank you again to Fowsia
Thank
for
you.
joining us. And with that, folks, we are going to turn to the next portion of our evening, which is a chance to have a conversation together and for folks to come online and share what you are seeing or experiencing or to ask questions of me. So we are going to follow, for those of you who have been with us before, what is our usual process of if you can raise your hand by going to the bottom of your screen and clicking the raise your hand icon, then we'll be able to call people onto the screen with me so that we can talk together. And I will just ask for your patience because it always takes a couple of minutes for the technology to keep up with us. And as we are waiting for the first person to join us, I just want to remind people that we do have an election coming up here in Maine on July 14th. And because of coronavirus, we want to make sure that people are staying extra careful. And we want to remind people that you can vote by mail. You can vote with your absentee ballot. You can do that easily by going to saragideon.com/vote by mail. And I see we have a guest with us. My request to each guest for the benefit of people who are watching is to please just introduce yourself and where you're from and anything else you want us to know.
Hi, Sarah. It's Pam Moss from Owl's Head.
Hi, Pam. How are you?
I'm just fine, thank you. As you can see, I'm sitting here on my deck enjoying this beautiful day. Here's my question. I keep going back and forth about the corridor project. I the benefits of it, I can see the disbenefits of it. And so I don't have a position, but I realized what I'm really concerned about is making our second district in northern Maine more viable through the access to the internet. And I think that that's what I've been most attracted to about the corridor project. So you don't have to speak to whether you're for or against the corridor. My biggest question is, what are you going to do to make sure that that area gets access to broadband and the internet?
Yes. Excellent. Pam, I'm so glad you brought up actually both of these subjects because first, I have been pretty public about my position on the corridor, the CMP corridor, and I do not support that project. My reasons are very specific. I do not believe that the climate impacts actually outweigh the negative environmental impacts of building that project throughout Maine. And, there's a lot of arguments around that, but ultimately we have not seen real proof that they are going to lower carbon emissions by building this project. But I know that we'll see a lot of damage done to the areas in Maine that we care about and that are special to us. Now, in terms of the other subject that you mentioned, which is broadband, I think that this is one that's vitally important for us to talk about and to recognize that there is a limited amount of work that we have done at the state level, but that there is a tremendous amount of work that we need to do from the federal level. And this is both for the state of Maine, but also for rural states across this entire country. There is a place in which the market stops naturally investing. And if we want to think about how we keep rural America alive and vibrant, how we keep people living there or really entice people to move into those places, build their businesses, scale up their businesses, it is about having broadband access. And certainly this pandemic has shown us that it's also a matter of equity. We have kids who live in this state who during this pandemic have not had access to the internet in their own home to continue with remote learning. So it's something we must do. It is an investment that needs to come ultimately from the federal government in order to encourage states to build out their broadband. And that is something I am deeply committed to and believe that our well-being, future, and economic vitality is dependent on. And thank you so much for asking about these subjects, and very nice to see you.
You too. Good.
Take care, Pam. So as we are waiting for our next person to join us, who I think is about to come up on the screen, I just want to, continue to recognize and applaud the essential workers who have carried all of us through this pandemic. It has been challenging times. We are starting to see people emerge and businesses open, but it is not only those medical personnel, but also our grocery store workers, our gas station attendants, and pharmacy workers, and people working in meat packing plants and more that have kept us all safe and healthy. I see that Kimberly has joined us. Hi, how are you?
Hi, I'm good. Thanks. How are you?
I'm doing well. It's nice to see you, and thank you for joining us.
Thank you. So my question is, my husband and I are self-employed, and our healthcare premium, just our premium, is over $1,500 a month. And by the time we pay, co-pays and deductibles, we could easily spend $25,000 on healthcare this year, and we're healthy. That's two of us and my college-age son who is insured. No prescriptions, no ongoing. So my question is, what realistically has to happen for some kind of healthcare reform to happen? Like, I would gladly spend some of that as a tax or a something. I think everybody's contributing. Most people, you pay your employer for part of it. How can we take that and so that there's healthcare for everybody? And I think as we look at people who were impacted by COVID, a lot of it probably has to do with healthcare. The fact that, poor people are not going to go get tested because they may not know if it's paid for or not. So we need some kind of reform, but realistically, is it having all Democrats? Is it what needs to happen?
So Kimberly, thank you so much for both sharing the realities of healthcare for your family and challenges, but also for asking this question. And I want to start off with just recognizing two things that I think or hope universally that we recognize. One, that right now we have a system that doesn't work, where people are making choices every day that they shouldn't have to make about whether they're able to see a doctor or buy their medicine or put food on the table or pay their rent. And if you'll excuse me for one moment, the perils of working at home. Ben, can you not do anything else in the kitchen right now? So the other thing I want to just mention is that through this pandemic, as you just pointed out, Kimberly, I think we have seen all the inequities that we already knew existed in this country around income, around access to healthcare, around education, around access to broadband, as Pam just asked, laid totally bare in front of us. And I hope that we can use what is this crisis now to help us come together to get things done. You know, we have seen ourselves argue about healthcare for decades now without actually making any real progress. And your question was, is it about having Democrats? I think it is about having people, no matter what their party affiliation is, be determined to focus on the goal of every person in this country having access to healthcare that they can afford, and then coming together to make a plan from there. I think that we have good foundations to work on. I think the core provisions of the Affordable Care Act are vitally important to all of us. Unfortunately, we have seen real damage done to that. Just for example, in Friday's announcement from the Trump administration that people who are transgender will no longer be protected under the Affordable Care Act. That is incredibly devastating and just plain wrong. But there are steps that we can take to, for example, take an existing Medicare program, expand access to it for all people to purchase, but also make that program better at the same time, and put caps on costs on it, and make sure that people can afford it and that it is not breaking the bank in order to have access to that healthcare. So this is a conversation that Americans need to have and have seriously. And I hope that this pandemic will be the wake-up call for us to finally do that. I know that in the US Senate, I am absolutely determined to do exactly that.
Thank you.
Thank you so much, Kimberly. So speaking of things that have happened recently, I just want to recognize what happened yesterday in the Supreme Court. Their ruling yesterday that civil rights protections to LGBTQ people and workers that we as a country honor them. And in fact, that discrimination against people in the workplace simply because of sexual identity or preference is not something that we do as Americans. So I think this was an incredible landmark day for all of us in this country, and just want to take a moment to pause and to celebrate that together as well, as we're waiting for our next person to join us on the screen. And it looks like that person is about to appear. So, hi there, how are you? You are muted right now, so we just need to unmute you, or if you know how to unmute yourself.
All right, hold on.
There you go. You've done it successfully. Hi, how are you?
Hi, Robert Loudon in Portland. I've been living out of state for 5 months, but I came back a few weeks ago, and among other things, I'm trying to figure out who to vote for in the upcoming primary. I received a lot of emails about you while I was gone, mostly fundraising queries. But when I got home a few weeks ago, I read a newspaper article that said you declined to participate in 2 recent scheduled debates with the other 2 Democratic candidates. And I was just wondering if you could explain what's behind that.
Sure. Well, actually, what I am very happy to share with you, Robert, is that we have 2 Democratic debates coming up. They are scheduled for next week on Monday evening with the Maine Democratic Party. And then we have another debate scheduled for about a week and a half after that, which will be a statewide televised debate with MPBN. So we are looking forward to having those debates and scheduled more than one debate, knowing that it was important for people to have a choice as to what they could tune into. So we'll make sure after this, if you're interested, that we get you the information on the dates and times of those debates for you to be able to tune into. But I also expect that, fortunately, in our modern world, people will have access to them at any time, through our replays on the internet, Facebook, Zoom, etc.
Okay, so there are two forums coming up that you definitely plan to participate in.
Two debates that we've confirmed participation in. One next Monday evening, and the other one in the beginning of July.
Okay, thank you.
Thank you so much, Robert. I appreciate your question. So I just want to remind people again, if you have a question for us tonight, you can go to the bottom of your screen and you can click on the raise your hand button in order to have your question or have your time with us. And I see somebody named Sophie is going to be joining us next. Hi there.
Hi.
How are you?
Thank you so much for. I'm good. How about yourself?
I'm great.
My name is Sophie, and I'm currently an intern for the Planned Parenthood of Maine Action Fund. So I'm excited to be with them during this important time for reproductive and LGBTQ rights. And you kind of addressed the Supreme Court decision that was yesterday, but I was just wondering what you thought of Kavanaugh specifically.
Of Kavanaugh's dissenting opinion, or do you mean just of him as a Supreme Court justice overall and the process and the bigger picture there?
I mean, mostly with the dissent, but both opinions are welcome.
Well, thank you, Sophie. Thank you for that question. And I think maybe I'll start overall, just a little more broadly, and then answer your question also. But we saw when Kavanaugh was going through confirmation hearings, I think we really saw, unfortunately, somebody who displayed a temperament that I think is not befitting somebody on the Supreme Court. And of course, as you mentioned, you are an intern now for Planned Parenthood, but I think that so many of us had real concerns about his respect for precedent, particularly the precedent of Roe versus Wade. And we have watched, even as we worry about what might happen to Roe versus Wade, we have watched state by state across this country make systematic attacks on a person's right to choose and reproductive health care overall, criminalizing, even attempting to ban access to abortion. And, whether we think about that particular issue or whether we think about the role and the opinions that Kavanaugh has displayed since he has become a member of the Supreme Court, including that decision yesterday, I think it is incredibly disappointing and notable that Susan Collins was the deciding vote for him as a nominee, and that we are seeing over and over again that he does not respect precedent, and also that he is issuing and becoming a part of decisions that don't reflect our values as Americans, our values of inclusivity, and our values to protect people and give people the freedoms that they deserve simply from being a human being and an American. So I think overall, when we talk about what the United States Senate looks like and who represents us in the United States Senate, we have to recognize the importance of what the judiciary likes and the role that the Senate plays in confirming judicial nominees, that this Senate has become virtually a rubber stamp for President Trump's nominees, and that it's literally changing the face of the judiciary. Whether we think about the issues that we care about, like healthcare, like reproductive healthcare, like the environment, unfortunately, all of those are at risk for generations to come now because of those decisions that Susan Collins and her colleagues have made in the US Senate. And thank you so much, Sophie. Thanks for joining us tonight. And thanks for the work that you're doing also.
Thank you to you as well.
Thank you. So as we're waiting for our next guest to join us, I just want to remind people that if you are looking for the latest information on what's happening with COVID-19, how to be connected to resources, what are the latest executive orders, you can always go to saragideon.com/COVID-19 to find that information easily. It will always be right at the bottom of your home screen when you go to our website. And on that note, I see we have our next guest joining us. Hi, how are you? Oh, so it looks like you are still muted. Yes, there you go.
Hey, sorry about that. Hey, John Levitt from the Carpenters Union. I
Hi.
want to ask you, where you mixed everyone together, Republicans and Democrats in the House, would you do the same thing in the Senate? Would you push for more, more mixture working together? It seems like Fowsia was saying, like in Lewiston, it's just natural to work with someone sitting next to you or living next to you, rather than across the aisle as like with the divide,
Yeah.
So would you push for that in the Senate as well?
Yes. So, hi, John. Nice to see you. Thank you so much for joining us tonight and for that question. I was just talking about this today with somebody else, that the work that you have seen me do and the way that you have seen me interact with others here during these years in the State House is exactly what you should expect from me in the United States Senate. Whether it is the idea of bringing people together and getting rid of the proverbial aisle, whether it is, starting from scratch by trying to identify what is the goal that we're trying to achieve, whether it is healthcare that people can afford, whether it is, stopping the climate change that is causing lobsters to migrate north or causing, greater storms with expensive damage to municipalities. These are the items that we can work on together if we see each other as human beings. If we look first to understanding what another person's goals are, what their hopes and fears are, and if we actually sit down together and just have conversations instead of retreating to our corners or planting our flags from the get-go, we can get things done. We've done it in Maine during the most difficult years of state government, and I know that we can do it in the US Senate, and it is absolutely what I want to bring there.
Yeah, good. It's just to change the mindset. So yeah, I appreciate what you've done here. So hoping you move it on, Thank you.
Thank you. Thank you so much, John. So as we're waiting for another person to join us, I know it has become really beautiful out there, thank goodness. But I also know that so many of us, as we're going out into the workplace or trying to have a little time in our lives with friends and family, it is still important to make sure that you're staying safe, following protocols like physical distancing from people or wearing your mask. So just a reminder to please try to follow those protocols. I think things have gone well in the state of Maine because we have followed those protocols and managed to flatten the curve and do well here. Hi, how are you? Sorry
Good. Hi,
to stop
Sarah.
you when you joined us.
Can you hear me?
Yes.
Okay. Hi, I'm Kathy Elliskew. I'm an author and a retired RN.
Hi, Kathy. Well, nice to meet you. Thank you for joining us. And that's an interesting combination of things.
My question is in regard to the COVID-19 and some of the regulations in the state right now. I'm noticing a huge divide between what is being asked of people and what is actually happening. I notice it in the senior housing where I live. I notice it in the grocery stores, pretty much everywhere. I take walks in a nice park nearby, and I see batches of kids together playing or doing a sport or getting in each other's cars if they're teenagers. And that part I kind of understand a little bit more than seeing adults. you know, I watch the governor. I like her very much, and this is a tough problem to sort through for anybody in office right now. But I watch her, you know, several times a week with Dr. Shaw, and they are asking very nicely for people to abide by, as we open up, they're asking people to abide by masks and distancing and hand washing, etc. I'm not seeing it very much, and which makes me nervous. And I don't know if there's an answer to this, but that's my concern.
Yeah, so Kathy, I appreciate your concern, and it is one that I hear echoed frequently, but also that I myself have, you know, as we go into stores and, you know, I always wear a mask. For example, when I go into a store, I will confess that I don't like wearing a mask, but I feel that it is important to do. Maybe most importantly, because as a healthy person, I could be somebody who is carrying this virus and could spread it to somebody else and somebody who is vulnerable, but also I could be vulnerable myself. I don't want to have a false sense of things. So I think this has been the challenge. And I know I never want to speak for the governor directly, you know, because that's not fair. But I think that what she has tried to do through this process is through executive order to lay out either direct orders, whether it's, you know, the closure of the economy or the way that reopen and the directions to wear masks, but she has also done it in a way that doesn't have, you know, enforcement, for example, from, you know, police. And I think that it is the incredibly difficult place that we find ourselves in this country as people who, you know, should be looking out for each other and taking care of each other, but who certainly don't want to be under you know, the sort of lockdown that has us being pulled over for not wearing a mask or questioned about who's sitting in the car next to us and things like that. So I don't know that I have a good answer for you in this, except for that I think that the governor has worked very hard to try to appeal to people's better nature, to take care of one another, to be responsible, and that it is very challenging. And I know right now we're headed for some challenges in that, in conversations in the legislature of certain members who are saying that they want to be, for example, in a committee room, but will not agree to wear a mask. And so that's going to be a challenging situation as we think about how we responsibly keep people safe. So it's a work in progress, and I know that's not a satisfactory answer.
Well, I wasn't thinking that you might have a magic answer, but I was hoping. I just, you know, I've written to the governor a couple of times, and I'm sure she's getting inundated with messages, but I'm just concerned. I mean, I don't want it to turn into a police state either, but I'm concerned that there isn't maybe enough being done to educate people who might not be watching her every day or listening to her, or even, you know, reading articles about it. So I just wanted to put that out there, and I don't know, I don't have any really good ideas myself either about it, but it would be nice if it could be more of a popular thing to do the distancing and the mask and so on.
Yes.
You know, if it could be, if it could appeal to a broader segment of the population.
Yes, absolutely. You know, I will just say, I mean, I know that we've seen in some other states, you know, as people are not wearing masks and as they're seeing spikes, some governors saying we might have to go backwards if people can't abide by this. So, you know, I know that public health and safety has been her priority throughout this, and that she is closely monitoring the, you know, rates of positive tests that come every day. And interestingly, our rate is quite low. It's below 2%, which is a positive trend, even if we're seeing things that don't seem positive, you know, as we're viewing the world around us. Yeah. So thank you, Kathy.
Thank you.
Thanks for your work as an RN also.
You're so welcome. My pleasure.
Absolutely. Okay, so I think we have time for another question or two still. And just want to remind people that small businesses in Maine are still really struggling, and that there is, even if you are not somebody who wants to go into a store or restaurant right now, that you're still able to support your local small businesses by ordering food or ordering products and picking them up curbside. So just an encouragement to continue doing that. The emergency is far from over. And hello, how are you?
I'm pretty good, Sarah. How are you doing tonight?
I'm doing well. Nice to see you.
Good to see you. So first off, it's really great. My wife and myself are both saying that you're so personable. So we really love that about you.
Thank you.
And the question that we have was, have you been approached with PAC money? And if yes, which money have you taken and accepted, and which ones have you turned down?
Yes. Well, thanks for that question, Chris. So actually, we made a decision when launching this campaign to reject corporate PAC money. And so I do not solicit or take corporate PAC contributions from corporate PACs. So
Awesome.
yeah. And, I just want to say, on that I think it is really important when we look at what is happening or what is not happening in Congress, that it is really, really very clear, if we trace the roots of things that are put into laws. So I often use this example, but I think it's a really, really important one. If you look at Medicaid, prescription drug programs, Part D of Medicaid, there is this clause in there that says the federal government cannot negotiate with drug companies for lower drug costs. And if you ask yourself the question of how that got in there, the answer is pretty obvious. The lobby able to put it in there. It was the pharmaceutical industry. And when you have corporate PACs making contributions to lawmakers directly, I think unfortunately we see over and over again that it prevents us from getting work done. And I would like to see everyone make that same pledge. And I would like then for us to go into the Senate and really change what campaign finance looks like and electoral politics looks like in this country.
Would you mind if I asked one more question?
Sure.
Oh, great. What are your views on possibly trying to get them to get rid of the Electoral College and maybe hardening the prerequisites for a president-elect to show his taxes, to prove that he understands what the Constitution is, to prove that he understands what just US history is before he can even run?
Yeah. So I will say, let me answer the question about the Electoral College, which I am, on the record for, even from the State House and my votes in the State House. I do believe that the popular vote is a system that allows everyone's voices to be heard. And I have voted for Maine to become part of to join a number of states who have also voted in that same way. And if enough of us actually do that, then we could change what that system looks like, that electoral college system looks like. So that's very important to me. As for your other questions about, proving proficiency and history and stuff, I have not considered that before, quite honestly. And so am not really inclined to answer that on the spot. I would have to think about that a little bit, but I appreciate the thoughts. And I think, unfortunately, we see right now a president who is not displaying the ability to lead the country, and the consequences are so real and devastating, to the tune of over 115,000 people who have died. And, I just saw a news headline that I didn't have the chance to read before I came on tonight, but also I saw that more than 98 cities across America, tear gas or pepper spray has been used on protesters. There's something really not right here, and it's happening because of the lack of leadership of this president.
He's a failed game show host.
Yeah. Thank you so much for joining us.
Thank you so much.
Thanks for your thoughtful questions. So I know we're just about at 7 o'clock, but I think if there is another question in the queue, that we can certainly take one more question tonight before we sign off, and I'll let Tim let me know if there is somebody else. I see another person joining us and look forward to, it looks like her name is Emily Trask-Eaton, and somebody I have met before, so looking forward to her joining us. Hi, Emily. Oh, but I can't hear you. You're muted at the moment.
I think I got it.
Okay, you did it.
Well, nice to talk to you. So I have a question that's a little bit out of date, I think, although I did hear a reporter referring to the same issue way back in the beginning of all of this coronavirus craziness. Jared Kushner talked about the federal reserves of PPE.
Mm-hmm.
And made the comment that those reserves don't belong to the states, they don't belong to us. Those were his exact words, and I presume he means to the people of the United States. But I've always wondered, were those reserves distributed throughout the country? So that's one question, and then I'm going to give you another question, sorry. The other is, you do what you can based on the time. The other is about schools resuming in the fall. I'm a school board member, and we have a budget, and we have to vote on the budget now when we don't know what's going to happen, and there's a lot of controversy about that. Would you anticipate any help from the federal government with state schools? I don't know how we're going to deal with this, with funding the schools.
Yeah, so I'm just going to start with the second question, because my immediate answer from my heart and my gut was the federal government has not helped us. So I would not anticipate help with our schools, but that was a visceral reaction to your question. Let me try to answer it in a different way. First of all, I think we are all in this place of both wanting to participate in the discussions, but also waiting to see how COVID-19 continues to progress. Will there be a surge, and what will the recommendations be from the Department of Education? Right now, the Department of Education is looking for feedback from individuals and municipalities and school boards and districts, as I think you probably already know. In terms of help from the federal government, the help we have received so far in terms of CARES Act funding has given money to states to use for COVID-19 related expenses only, very specifically. And there has been some funding made available to municipalities with populations greater than 500,000. Of course, that doesn't apply to the state of Maine. When we look just in terms of state shortfalls, revenue shortfalls, we expect those shortfalls to be as much as $1 billion over the course of the next year. That's not even touching, as you're talking about, Emmy, the shortfalls in revenue, tax revenue, that municipalities will be facing, and therefore that school districts will be facing. And so we have got to think about how we get more help from the federal government in the short term to help with these shortfalls. And we all need to raise our voices and to ask Congress both for that and also for help in terms of loosening the restrictions that were on the original CARES Act funding. So vitally important. I don't know what we're going to get. Unfortunately, I think that second round of help should have already come from Congress. We saw the House pass the HEROES Act, and the Senate has done nothing else in the meantime. So that is something we need to be very loud about. And then your first question was about the reserves that we might have and stop. Look, the idea that that is not for states or not for us, government, federal government, state government, local government is government for the people. It is meant for us and to serve us. Those stockpiles should be there exactly for the times of emergencies. And instead, we had a situation where we had states, municipalities, counties literally bidding against each other and the federal government in order to get personal protective equipment in place. It is so unbelievably outrageous. I just have no words for it. And what it means in practice is that we have seen more than 115,000 Americans die who didn't need to die, because this president and this administration and this federal government, enabled by the Republicans in the US Senate, have allowed him to continue to operate without making sure that we were taking care of each other.
Right.
So I thank you for bringing those two questions up. I thank you for your work on the school board. I know your job will be 10 times harder than it already was. And we all know that that municipal level work, and particularly working on our school boards and school committees, is some of the hardest work there is. So thank you. And I hope we get to cross paths in real.
Yes.
And I say that to all of you who have joined tonight. One thing I don't like about these virtual town halls is that I don't get to see everybody's faces at once, but I want to thank you for being a part of this discussion, for continuing to tune in and communicate, to ask questions, to demand answers, to come up with solutions, to help your neighbors. That is who we are as Mainers. It's who we are as Americans. It's who we are as human beings. And it is how we will get through a crisis that is far from over, even though it feels like things are opening up and changing around us. Thank you, and we'll see you next time. Please take care of yourself and your loved ones.